In this lecture, we will discuss the external cranio-cervical ligaments. These are on the external side. So let's start with the labels. The label 1, that is the posterior atlanto-occipital membrane. This you can see the posterior view. Okay. This is label 1 is the posterior atlanto-occipital membrane. The label 2 is capsule of atlanto-occipital joint. This is the capsule. The label 3 is transverse process of atlas C1. ठीक है. This is the transverse process of atlas, that is the C1. Label 4 is the capsule of lateral atlanto-occipital joint. This is also a capsule. The label 5 is the ligamentum flavum. This is present in the cervical vertebrae. This is the ligamentum flavum. Label 6 is the capsule of atlanto-occipital joint. This is the also the capsule. The label 7 is the posterior atlanto-occipital membrane. The label 8 you can see here is the ligamentum flavum, and label 9 is the ligamentum notch. It's present in these two ligaments present in cervical vertebrae. The label 10 is the anterior longitudinal ligament, and the label 11 you can see here is the artery. It is the vertebral artery. Now we will discuss the atlanto-occipital joint. It is on each side is covered with an articular capsule and posteriorly reinforced by the posterior atlanto-occipital membrane. Its anterior side we have a capsule and posterior is the membrane. Ligamentum notch is strong median fibrous septum. It is an extension of the thick supraspinous ligament. It is the extension of supraspinous ligament that rise by the spinous process of C7 and is extend up to the external occipital protuberance. Okay. Now we will discuss the clinicals. While there are usually C7 cervical vertebrae, fusion of adjacent vertebrae can occur, and the most commonly fusion in the cervical region between C1 and C2, that is the atlas and axis, or between C5 and C6. In this lecture we will discuss the external cranio-cervical ligaments. We discuss all the labels, their atlanto-occipital joint anatomy, and the clinicals. I hope so you like this video. Thank you.